Okay, we talked a bunch about blood. We're going to talk a little bit about the blood tubes that you'll see in vet med. These are the two most common tubes that you'll be using to run things like chemistries and CBCs. So on the left, you have the serum separator, which has different looks. It can have the tiger top, which is kind of a red marbled gray. They can be red and black. They can be orange. Any tube that you purchase, depending on who makes it, the manufacturer, it will say on the side of the tube whether or not it's a serum separator. It'll say SST. So, and the serum separators will have gel in them. So the one below that is shown here has gel in the middle and clot activator in it. So the clot activator in the tube will stimulate the blood to clot. And again, remember, when blood clots, it makes serum. So the fibrinogen is removed from the plasma, and outside of the clot, we have the leftover fluid is serum. These tubes we use in vet med for chemistries and antibody testings and lots of other things. When you pull blood into these tubes, you're going to collect the sample and add it to the tube, either through the vacutainer or by taking the top off. And you're going to let the blood clot first before you spin it down. Depending on the species, again, like for example, horses' blood takes a long time to clot. But generally, most blood clots within about 10 minutes, and then you're going to spin it down. So after a centrifuge, you usually centrifuge for about 10 minutes. And once the blood is separated, you will see that the gel will be in between the cells and the serum. The gel is designed to have a density that is slightly less than the serum, but more than the cells. And once these tubes are spun down and separated, you cannot remix them or reconstitute the blood into whole blood again. Another important thing to note about serum separators is that if you leave the blood clotted and do not centrifuge it down for some time, the glucose will start to deteriorate in the tube. So the glucose level will go down as much as 10% per hour that a serum separator tube is not centrifuged and separated. To the right, we have the EDTA tubes. Don't ask me to say what EDTA stands for. It's right there. It's a very long word. EDTA is a chemical that is added to the blood to keep it from clotting. So it's an anticoagulant. So blood in purple top tubes is whole blood. And EDTA is also used to preserve cell morphology. So it is what we use when we're reading a CBC. So when you make a blood smear or you run a CBC, you're using an EDTA purple top tube. It is otherwise known as the hematology tube. Purple top tubes must be filled to the line that is indicated on the tube so that the additive and the blood ratio is correct. And also, after filling a purple top tube, you should gently invert it so that the anticoagulant mixes with the blood and it doesn't clot. We have these rockers that you can put the tubes on that rock it for you until you're ready to run the sample. Two other more common tubes you may see are the green top tube and the plain red top tube. The green top tubes are commonly used for chemistries, for exotics, and other specialty tests. There is heparin in these tubes, and as you may know, heparin is an anticoagulant, so it keeps the blood from clotting. So when you keep the blood from clotting, you have whole blood. So that means when you separate out these green top tubes, you get plasma, not serum. Now, these green top tubes may be made with gel or not. So if they have gel, it will separate out the plasma for you when you spin it down. The ones without gel, the only difference is that if you tip it, it's going to remix again, but it's still going to give you plasma when spun down if it's a green top tube. The lithium heparin blood is not used for blood smears or CBCs, as the lithium heparin may interfere with the staining or cause clumping. And this is another tube where you want to make sure that you put in the correct amount of blood so that the anticoagulant mixes with the blood in the proper ratio. The plain red top tube is another tube that we use for certain chemistries. For example, it's used for digoxin levels commonly. they can either have no additives in the tube, or some of them may have clot activators. And again, it's gonna say it on the side of the tube on the label here. It's gonna say whether it's a no additive or a clot activator. But when you put blood in these tubes, they are going to clot. So this tube is going to yield serum. So again, they may have no additives, or they may have a clot activating coat on the inside. These are also sterile tubes. The non-additive tubes can be used for urine, blood, bodily fluid. Again, this is something where you'd want to label what you're putting in there in the non-additive tube. And they can be centrifuged down. And again, this is a tube. If it doesn't have gel, if you mix it or if you invert it, the blood in there is going to mix again. But when you spin it down, you will have serum on top, because the blood does clot in these. The blue top tubes are what we call our coagulation tubes. Most tests that we do to see if a patient is having coagulation issues are done off of the blue top tube. Most common are the PT and the PTT, for example, prior to surgery. The blue top tube has sodium citrate in it. Now, with the blue top tube, it is extremely important that the ratio be correct, and there is a line indicated on these tubes, and with this tube, it's more important than others. The blue top tube, again, is used for coagulation studies, and it always needs to be filled to the line. So whenever you're pulling tubes, you may want to make sure you have enough blood in this tube first. The gray top tube is a lot less common than some of these other ones, but they have potassium oxalate or sodium fluoride additives. They're used for certain coag testing as well, and glucose studies. The gray top tube prevents glucose from being utilized by cells for energy to preserve real-time value. And this is another tube where you want to have the proper ratio to the additive of blood.